is your drive home? 30 minutes? 20 minutes? Let's say 20 minutes. In the time it takes you to drive home from work, 3 people will be dead from accidental drug overdose, which has overtaken heart disease and any other form of death in the United States. According to Elizabeth Y. Schiller in her book, Opioid Overdose, published January of 2022, drug overdose is a leading cause of accidental death in the United States, with opiates being the most common drug. The CDC currently estimates that more than 1,000 emergency department visits daily relate to the misuse of opiates, and about 91 opiate deaths every day. According to the CDC, in an article dated May 11, 2022, provisional data from the CDC National Center for Health Statistics indicate that there were an estimated 107,622 drug overdose deaths in the United States during 2021. Drug overdose is the #1 cause of accidental death, and it is 100% preventable. This speech is going to outline the dangers of fentanyl epidemic and how certain safety measures and STD treatment can stem the tide of stiff blue corpses. Over the course of this speech, I'm going to help examine the cause of opioid deaths. I'm going to outline certain safety measures, and I'm finally going to walk through the process of treatment. Fentanyl is a highly deadly opioid, and it's not being prepared by medical professionals prior to consumption by the addict population. The DEA states in their article titled Facts About Fentanyl, published November of 2021, producing illicit fentanyl is not an exact science. 2 milligrams of fentanyl can be lethal depending on a person's body size, tolerance, and past usage. DEA analysis has found counterfeit pills ranging from 0.02 to 5.1 milligram, more than twice the lethal dose of fentanyl per tablet. Compounding that already terrifying factoid and the powers be ruthless love and money and efficiency, there are now analogs of fentanyl. Fun little fact like ISO and carfentanil. As far as carfentanil goes, it's 100 times more lethal than fentanyl. According to Jonelle Smith, MD, in her article, What is the Lethal Dose of Carfentanil, dated July 5th, 2021, the lethal dose of carfentanil is 2 milligrams, the same lethal dose of fentanyl. But a person can respond to a dose as low as 1 microgram, which is 0.001 mg. Carfentanil was originally created in 1974 by a team of chemists with the purpose of tranquilizing large animals in veterinary work. It was never meant for human consumption. A dose of carfentanil the size of a grain of salt could be lethal. And as you can see from the data I've shared, the opioid crisis is a terrifying and lethal thing. But what caused the epidemic and how can it be stopped? Most opiate users use illicit street sources of opiates which are neither carefully dosed or anything resembling safe. But they did not start that way. In fact, most opiate users started their spiral into drug addiction by abusing or misusing pharmaceutical painkillers. The burden of responsibility has to start somewhere. Was the pharmaceuticals industry pursuit of profits and new revenue stems the cause of the ocean of sorrow that is playing out today? I can only state facts. According to Rebecca Haffey, PhD, and Michelle Mello, PhD, authors of the article Drug Companies' Liability for the Opioid Epidemic, published in the New England Journal of Medicine on December 14, 2017, in the case of West Virginia versus Purdue Pharma, it was alleged of Purdue aggressively marketing OxyContin to the state residents, many of who became addicted. Concealing from prescribers to the extent to which OxyContin qualities could lead to addiction. The company paid, in that case, $10 million over the course of 4 years, but admitted no fault. In another case involving 26 states and the District of Columbia versus Purdue, the manufacturer of OxyContin, the company, while not admitting any fault, settled to the tune of $19.5 million and was required by the court to set up and maintain abuse and diversion detection programs. Sounds like a lot for something that wasn't your fault. Good. Now we have the problem outlined and the source identified. Without that, no cure and no solution can ever be followed. There's plenty of solutions to these problems. Naloxone, an opioid antagonist, and literally the agent that has been administered time and time again to bring back overdosed people from the brink of death, could be made more readily available. And it actually looks like this is the trend. In their article, California may now dispense Narcan without prescriptions, dated April 2015, the National Association of Board of Pharmacy states, pharmacists in California may now provide naloxone. The medication can help to reverse the effects of the opioid overdose without a prescription. Readily available Narcan will save countless lives. Substance Abuse Treatment Center funding couldn't hurt either. Now, in this speech, I have covered exactly what the opioid crisis is, the cause of the opioid crisis, and what preventative measures have been taken. The opioid crisis is the #1 cause of death at this time and is completely preventable. Through recursive self-improvement, we the people can make change at the state and federal level to help stop the tide of darkness. In the time that it's spent to cover all this information, 3 people have died from opioid overdose. And it sounds like abstract statistics, but I pray for those who have passed, and I wish that it never touches any of us directly, even though it has in my life numerous times. Thank you.